أول شيء I want to just take you backwards a little bit, and I
Okay.
want to make sure that moms and dads, لأنه this is the couple's responsibility, are very clear what they want with their gynecologist
Mm-hmm.
around the delivery time.
Mm-hmm.
So they can decide with their OB, أكيد this is not what I do, but they can decide with their OB about the management of the pain, their delivery, how they want it, the setting, etc.
Definitely, definitely.
But since we brought up skin to skin, this is also one of the things that moms and dads need to talk about to their gynecologist.
Mm-hmm.
Unfortunately, in Lebanon, it's still not, إذا بدك, a reflex for the gynecologist دغري يحط
حط
البيبي
البيبي.
على المام أو على الداد ليعمل skin to skin. So this is something we still, as moms, need to ask about and ask for, لأنه this is the best thing for the mother and for the baby.
Yes.
هلا assuming everything is right أكيد مثل ما قلتي سنتيا, بس even if things are not right, if the dad is around, I would advise putting the baby on the dad if mom is not doing very well. هلا if the baby is not doing well, this is something else. Okay, so that's when skin to skin is not recommended. So شو يعني skin to skin? Skin to skin is basically when the baby is born, and after the cord is cut. We can talk a little bit about delayed cord clamping, إذا بدك كمان. But
Definitely.
after the baby is born, and when we made sure that everything is okay, it is recommended to put the baby on the mother, ideally for up to 2 hours. Okay, so skin to skin was shown to be beneficial on multiple levels. أول شيء, it stabilizes the temperature of the baby, because babies, when they are born, they get cold. So it stabilizes their temperature because the baby is on mom and is feeling warm. It stabilizes their heart rate. It brings down the heart rate of the baby. It brings down their respiratory rate. So if they are breathing fast, they calm down. They can hear the mom's heartbeat when you put them on the mother. And it's extremely important for breastfeeding. The studies have shown that when skin to skin is done properly for a certain amount of time, like up to 2 hours, it actually promotes breastfeeding significantly. Moms who do skin to skin have the earlier onset of milk, and believe it or not, but babies even latch better on the mother whenever they
Definitely.
do skin to skin.
They can
هلا
smell, they can see, you
exactly,
know. So it's,
exactly,
yeah.
definitely. هلا if for some reason the mom عملت urgent C-section, she's not stable, things happen, the dad can take his shirt off and can put the baby on him. The only thing that was not shown to be as helpful when the baby is on the dad is breastfeeding, obviously.
Exactly. But most
But
of the time, the baby's like this, searching on
yes,
the breast of the dad, you
yes,
know.
yes, exactly. So this is called the rooting reflex, and the baby will
Exactly.
be rooting. This is
Exactly.
just nature's way to make baby breastfeed immediately after they are born.
Exactly.
So the
Exactly.
dad can do skin to skin كمان up to 2 hours. هلا we don't recommend more than 2 hours لأنه at this time the temperature of the baby can start to come down. ممكن
Definitely.
يبرد شوي. The baby needs to be checked up, etc. It's
Definitely.
important to mention كمان Cynthia إنه actually breastfeeding can start then. يعني the mom
Definitely.
can put the baby on her skin to skin and can also attempt breastfeeding.
Yes. So I'm so happy that you mentioned that it starts قبل البirth. And usually as a prenatal educator, once my moms, and dads take the full prenatal education program, at the end we design birth preferences. Those birth preferences بناخدهم to the doctor and we discuss them all. Again, their preferences. It's not a plan, it's preferences. Inshallah, all of them can be achieved. But you have to keep in mind that something might happen with the mom, with the baby, so it's flexible. So we talk about skin to skin, we talk about keeping the baby skin to skin, even during a C-section. أكيد بركة مش as comfortable as a normal birth, but we keep the baby skin to skin, and then the dad بكفي. And I had moms doing skin to skin for 30 minutes during a C-section حتى. And then بكفي with the dad. So it's definitely doable. وأنا بتذكر when I used to work as a full-time nurse, I used to fight to keep the baby skin to skin and breastfeed and then take the baby to nursery. you know.
Yes.
This is again, like you said, it's not a routine thing done, but nowadays doctors and the team, the staff عم بيتقبلوا هالشيء أكتر, and they're keeping the baby if we ask for it. So definitely it's very beneficial, and push for it as long as the baby is good and the mom is good, go for it. If the mom is not منا كثير مرتاحة, منا قادرة تركز على البيبي, then definitely the dad can do skin to skin, and then the baby goes to nursery.
So the other thing, Cynthia, Kamen, that's important to mention is that this is all great for the baby, but skin to skin is also great for the mother.
أكيد.
لأنه this bonding will be immediately established. She will forget the pain. She might not forget it totally if she's in pain, but she
Exactly.
will focus on the baby. وبهالوقت بكون كمان الدكتور or you know he or she are continuing to take the
Continuing.
placenta out, so she will get distracted from all this procedure while looking at the baby, smelling the baby, you know, and
Plus it
establish this
decreases the
immediate
risk of,
bonding.
yes, and it decreases the risk of bleeding too. لأنه when the baby is on
Exactly.
the skin, you have oxytocin high. Oxytocin is a hormone, for those who don't know, which helps with muscle contraction. So
Yes.
بيخلي اليوترس الرحم يدب وبيخفف bleeding. So
Yes.
definitely it helps on all levels, not only for the baby but also to the mom. Thanks for mentioning that. So yeah, ideally we would love to keep the baby skin to skin as much as possible. مثل ما قالت Dr. Sharara, عنا up to 2 hours. Then after 2 hours baby has to go to nursery. So بهال 2 hours يعني فينا نعمل المستحيل, skin to skin with the mom, breastfeeding with the mom, skin to skin with the dad, and then baby goes to nursery. So you have an expert opinion on that يعني, لأنه في كتير I want to say that, في كتير moms بيعطى لهم بتقول طب maybe pediatrician لازم يفحص البيبي ويتأكد إنه كل شيء منيح. No, بيخافوا بيعطى لهم لأنه it's their first experience. So know that as long as the baby is fine, as long as the baby is crying, as long as the color of the baby is great, ما تعطى لهم, you know, when it comes to skin to skin.
Yes.
Yes. So now skin to skin done, baby goes to breastfeeding done, كل شيء done, baby goes to nursery. Now what happens once there?
So the baby goes to the nursery. I just want to mention, Kamen, to expecting moms and dads that the baby doesn't need to be taken away from them. Okay, so we're having more and more parents ask to be present when the baby is taken to the nursery. So if the
Definitely.
mom is still in her room, the dad can usually come. So the baby goes to the nursery, and then we do basically a full physical exam on the baby. يعني أول شيء بناخد له وزنه. And actually the weight is taken inside the delivery room. But if not, we repeat it in the nursery just to double check that the weight is correct. We take the length of the baby and we take the head circumference, يعني how big the head is. So once we do these things, then we do a full head to toe physical exam. We literally look at everything بنفلي للبيبي. Okay, so أول شيء
exactly.
we listen to the heart and lungs. We make sure that there are no murmurs or what we call in Arabic صفرة بالقلب, which is somewhat not surprising in newborns, especially in the first few hours. So we listen to the heart and lungs. We check the shape of the baby. We make sure that there are no abnormalities just in the way where the eyes are set, the ears are set. We count the fingers and count the toes. We actually go through this exercise because sometimes if there are 6 toes, you might miss them if you don't actually count them.
Yes.
So we count the fingers and the toes. We feel the abdomen, the stomach, the belly. We make sure there are no masses or anything that is abnormal. We look at the genitalia. We make sure that it's clear that this is a boy or it's clear that this is a girl, because sometimes, you know, very rarely, but you have something called ambiguous genitalia where it's not clear.
Yes.
We make sure that the testicles are both where they need to be. We make sure that the skin on the penis is open where it needs to be open. And we make sure also inside the vagina that all the structures are normal.
Yes.
And so once we do that, we also do a hip exam. So we make sure that the hip joint is well, is not dislocated. And we turn the baby, we look at the back, we make sure that the spinal cord is intact and there are any openings at the bottom that are abnormal. And we make sure that the anus is open, actually. So once we do that, we also look at the face. So we do the red reflex. We make sure that there are no cataracts, يعني مي زرقاء. or we make sure that there are no whitish discolorations inside the eye that could signify that the baby was born with some kind of tumor in the eyes, as retinoblastoma.
Okay.
So we look at that, and then we look inside the mouth. We look at the gum, we look at the palate, we make sure that the palate is not open or clefted or anything like that. And we look at the ears, and we make sure that the ears are where they should be and that everything is fine. The last thing we do is the neurological exam. So we test some reflexes that we do on the baby. I already mentioned the rooting reflex. It means when we put our finger next to the baby's face, the baby will turn to take our finger. It doesn't necessarily mean that the baby is hungry. Okay, this is just a rooting reflex. And then, of course, with a clean set of gloves, we let the baby suck on our finger. We make sure that the sucking reflex is normal. And then we make sure that the strength in the arms and the strength in the leg, the power, is normal. And we do what we call the stepping reflex. So we hold the baby, and the baby almost naturally will step on the feet. And then we do the moro reflex. So we make sure that the spinal cord and the upper arm, like the arms reflexes, are all normal.
So it's basically full assessment, checking for reflex, abnormalities, everything.
Everything. And akid, we measure the heart rate, we measure the temperature, the vital signs, the oxygen level, which we also recheck, at 24 hours and then right before discharge.
Amazing, amazing. And doctor, what about the vaccine, the injections that are done to the baby after birth too?
So it's very important to take the parents' consent, okay, on vaccines. So the parents need to know exactly what's going to happen to the baby, and they need to approve of it. Okay, so we put erythromycin ointment in their eyes because sometimes while going out the vaginal canal, they can catch an infection called chlamydia if the mom has it. And it can cause, with time, it can cause blindness. So we put this erythromycin ointment in the eyes. Just right here, just to make sure that, the eyes are like clean and protected. And then we do 2 shots. So the first one is a vitamin K shot because the babies are born with an immature liver. Okay, so their liver does not make enough vitamin C. So if they are scratched, they might bleed a lot. They don't clot their blood because of the low vitamin K level. So we give them a shot of vitamin K. To prevent something called hemorrhagic disease of the newborn. So this is very important. It's done everywhere. And then we give them the hepatitis B vaccine. It's important to give the hepatitis B vaccine because hepatitis B is one of the viruses that's not only transmitted sexually, but it's also transmitted in the breast milk. So if the mom is breastfeeding, or if the baby was born by normal vaginal delivery, the baby can get it this way. Even if the mom tested negative, it's not enough for us to be reassured because the test is done at 28 weeks or so, and the baby usually are born much later than that. So we do give the first dose of hepatitis B at birth as well.
Okay, perfect. So it's vitamin K, erythromycin ointment, a second shot اللي هي hepatitis vaccine. And usually أكيد never يعني nothing is done without the consent of the parents. هلا usually vitamin K و erythromycin بينعطوا routinely. Or you also take the approval for this.
The way we do it at AUBMC is that we take one approval for everything. So we explain to them actually about the hepatitis B, about the vitamin K, and about the erythromycin, just so that they're not surprised. The other thing we do at AUBMC is a hearing test. So we test the baby's hearing because sometimes you cannot tell if they can hear well and can hear well from both ears, which could significantly hinder development if it's discovered after few months. So the thing I always get from the parents is يا سكرت البيبي ونقز البيبي. I know the baby can hear. So this doesn't mean that the baby can hear well and can hear well from both ears. The test is very simple. It's non-invasive. We just put a little electrode in the ear. We send some sound and we make sure that it's coming back properly.
And
So
doctor,
that
doing it على ظهر while the baby is still a newborn is much easier than doing it later on, right? This is what I know. لأنه في كتير sometimes it's not covered by insurance, so this is why moms and dads do not do it. You know, they prefer not to do it and say it's okay. بس عشان نرجع بنعملها. But then once baby is older, it's harder to do it, right? This is what I've heard.
so
More complicated, like
so
in terms of
it's
anesthesia
more
and
than
stuff.
just that. So the test is not covered by all insurances. That's correct. But the test costs 50,000, 50,000 lira, which is
Oh,
now
best.
like
Okay.
$10.
Okay. I thought it's more than that.
So it's not that expensive at all.
Okay.
It's non and it's non-invasive.
Perfect.
The reason why some parents opt to delay it is that maybe they have questions about it. So it's actually our duty to explain to them the
Explain.
importance of this test. I wouldn't recommend delaying it because the more you delay it, the more you interfere with the child's cognitive development. They need to really hear the words properly. We don't want them to hear like they are underwater. Okay. So you can do it later on. It doesn't necessarily require anesthesia, Cynthia. The one that requires anesthesia is the more sophisticated test.
Okay.
We call it the ABR, where we need the child to be completely still while we do it.
Okay, perfect. Okay, so definitely go for it. It's much
definitely
better.
Go for it. So the other thing that's also part of the newborn testing and examination is at 24 hours we do something called the newborn screen. So we take a drop of blood from the baby's heel and we send it out. Some of the tests are done in Lebanon, some are done outside. The test takes about 2 weeks to come back, and it tests for the most common metabolic and genetic diseases in Lebanon. يعني الأمراض الاستقلابية والوراثية. Okay, we test for the thyroid, we test for G6PD, which is common in our part of the world. يعني الحمى يعني التفويل مرض التفويل. And we test for other genetic diseases. This is not really optional, and this is covered by الوزارة وباي الضمان وباي all the insurance, and we do it on all babies, but just parents need to know that this is done as well.
Okay, perfect. Doctor, we had other questions about circumcision. So is it done the same day after birth or second day? If you can tell us a little bit about circumcision.
So it's not recommended to do it immediately after birth, of course. So first of all, the pediatrician has to examine the boy to make sure that مثل ما قلت قبل the opening of the urethra, يعني where the urine comes from, is where it needs to be. Sometimes the opening is below the shaft of the penis. Sometimes it's above. We call them epispadias and hypospadias. And these are contraindications for circumcision. So we wouldn't recommend circumcision in this case. Also, the size of the penis has to be the right size. So it has to be more than 1.5 centimeters in order to do the circumcision. So once the pediatrician sees the baby, the pediatrician will okay for circumcision. But we would still need to wait for the baby to void or to pee. Before the circumcision is done. We, most of the time, recommend doing it the next day because the baby has a lot of things happening these first few hours. So we recommend doing it the next day.
Okay. And usually I get a lot of questions on are you with, are you against? So if you can tell us scientifically, the rationale behind circumcision so that moms and dads can take their decision too.
So first of all, I just want to tell everyone that circumcision is really a cultural a ritual, if you want. Medically, the American Academy of Pediatrics, for example, has a standing on circumcision. Standing يعني موقف. يعني it's not a recommendation, it's not a suggestion, it's not either for or against. Okay, it's just a موقف. And the standing of the American Academy of Pediatrics is for circumcision. The reason why their stand for it is that circumcised boys have a lower incidence of urinary tract infection, so less urine infection, less incidence of sexually transmitted diseases, including HIV, and less incidence of penile cancer. Okay. Now, what I want to mention is that all of these things are very rare. Okay, so urinary tract infection is around 1%, the incidence of UTI in older boys. the incidence of sexually transmitted diseases is zero if we apply safe practices. And the incidence of penile cancer is very, very low. Okay, so you are taking something that is rare and you are making it rarer. Okay, so you're making it even more rare. So medically, we cannot really push for circumcision. What I always tell parents, it's up to you. It's cultural. It's like father, like son.
Exactly. Now, we also had questions about delaying the cutting of the umbilical cord. This is something you also mentioned in the beginning of the live. So if you can talk about it a little bit.
Yeah. So this is what we call delayed cord clamping. Okay, so delayed cord clamping is recommended. And so basically, after the baby is born, we don't immediately clamp the umbilical cord, but we let some blood go from the placenta to the baby. Okay, the clamping time varies, but it should be, less than 3 minutes. That's the recommendation. And the reason why we do recommend it is that it basically gives the baby more stock of blood. Okay, so there's less incidence of iron deficiency anemia at an older age because they have more stocks of iron. And some studies that followed these kids for a long time showed that it improves fine motor skills in boys at around 4 or 5 years of age. Okay, so for some reason, doesn't help girls that much. I think because they have better, fine motor skills. I'm kidding, but the studies showed that it was actually helpful for boys. But they definitely show less incidence of iron deficiency anemia and need for iron supplementation.
Yes, and sometimes moms and dads who want to do stem cells collection are HV companies who are saying, you cannot do more than 1 minute, you cannot do more than 2 minutes. So again, for moms who wants to store the stem cells, then you have to check with your company in advance. And this is why sometimes with birth preferences, I ask them to check with the company so that it's not a last minute thing, and they get disappointed. Delayed cord clamping.
Yeah.
Okay, now regarding the shower and the vernix, this is something I love to talk about because I also encourage my moms not to shower directly after birth because of the vernix. So if you can talk a little bit about that.
So the vernix is basically this waxy white outer layer that covers the baby when the baby is born, and it has actually shown to be very beneficial in protecting the baby against hypothermia. So it keeps the baby warmer. And it keeps the baby protected. It's like having a layer around the baby. So we used to shower the baby immediately after birth, but this has changed. And now we recommend at least 4 hours to delay the shower. And sometimes we even recommend up to 24 hours to delay the shower because of the vernix on the baby's skin. So it's definitely protective. It's definitely beneficial. And it's basically nature's way to protect these babies. It's like a nature's incubator, if you want, or the warmer for the baby.
Exactly. And there's a 2019 study that showed, Moaf, if you saw it, doctor, it showed that, babies who were kept with vernix had a higher chance of breastfeeding, exclusively breastfeeding too, because of the smell of the amniotic fluid, mitral around the baby on the vernix. So it helped the baby come in to stay in his kind of environment and catch the breast come in easily.
Yes, and definitely. And keep in mind, Cynthia, that parents who ask for the vernix to stay on the babies are the ones who also tend to breastfeed. So this is like, that's why,
it's
there's a little bit of a bias in this, but we definitely now encourage parents to keep the vernix on at least for a few hours after birth.
Okay, amazing. There's another thing I want to talk about, Kamin, which is the tongue tie. Okay, maybe you can essentially tongue tie. And as a breastfeeding specialist, I know this is kind of sometimes a barrier for breastfeeding. Not a barrier, but it leads to painful breastfeeding and sometimes it could be vicious cycle. So I just wanted to check, as pediatricians after birth, you also check for that, right?
Of course. That's why we have the baby suck on our finger, and we make sure that the suck is strong, and then we make sure that the baby can actually protrude the tongue out. Now, for some reason, you guys, like the lactation consultants, seem to diagnose babies more with tongue ties than we as pediatricians. I think because you spend more one-on-one time with the
Exactly.
mom and you
Yeah.
see how the latch is, etc. But it's not as common as people think. Yani,
Okay.
that the tongue tie that really interferes with latching and breastfeeding and
It's obvious.
even verbalizing,
Speech.
speech and sound is not that common.
So, best for those who don't know what a tongue tie is, when usually our tongue, easy to get it out. It's easy for us to get it out. But when you have a tongue tie, it's like kind of stuck, right? It can be
Yeah.
anterior من قدام لتحت أو بالنص أو لورا. It's posterior. So sometimes if babies have a tongue tie, the latch is a bit painful. But again, pediatricians check it out, specialists check it out for you not to go into that vicious cycle of painful breastfeeding. يعني. So okay, perfect.
So Cynthia, but allow me to comment
Yeah,
on,
yeah, sure.
I know Dr. Samer joined us and he commented on the hearing test that should be done
Yeah,
later
I
on
can see.
as well. So I know Samer very well. Thank you for this comment, Samer. But I agree with you that kids need to be, their hearing need to be checked again before entering school because a lot of these kids, well, first did not have a
Exactly.
neonatal screening. The other thing is that kids can have a lot of viral infections that go undetected and that can leave fluid in their ears. That's why, it's very important to check children's ears even when they're coming for vaccinations, because sometimes you can see some effusions in the ear, some water in the ears that can prevent them from hearing well and from doing well at school.
Thank you, Dr. Salman, for that comment. Okay, we have a question. What about stem cell storage in Lebanon? Could it be done?
Elian, it can be done. There are private companies that do stem cell preservations for children, for babies, for newborns. So it depends if you want to do it, if you agree with your gynecologist that this is something you want to do, then make sure to inform them so that the company is on board, as Cynthia said, because this can interfere with delayed cord clamping.
Yes, yes.
Personally, I'm not for stem
Me
cell
too. Me
preservation,
too.
but it can be done.
Yeah, and for any mom who wants to do it, I just would encourage you, I'm sure Dr. Sharara too, to research it, to research and read about it, Because if you read the guidelines, don't read anything, any kind of article. Read the guidelines of the American Academy of Obstetricians and Gynecologists. Lano, if you go on other guidelines or other articles, it's articles from stem cells collection companies. So there's a lot of bias sometimes. So just read good references as I
Definitely don't Google benefits of stem
exactly.
cell preservation because you will get all kinds of responses. So as Cynthia said, just Google, guidelines about stem cells in newborns, preservation in newborns. But the science is very iffy about it. There's a lot of gain from it and not much benefits. So I
Yes.
actually would not recommend it.
Yes, me too. But again, you can go and read to double check and make sure. So we have another question. So if we have a history of heart diseases at birth in the family, should we take special precautions, I think?
I don't know what you mean by special precautions, but if you have a family history of congenital heart disease, then the
Definitely.
pediatrician should know. And the baby will then need to be screened with an echocardiogram. And we also take the pulse oximetry of the baby at birth and then again at 24 hours. When the holes that were left, actually can show a low oxygen. But even if the baby does not have a murmur on exam, definitely mention it to the pediatricians. A lot of the congenital heart diseases are actually genetic in origin. So the babies will be screened and mention it to your pediatrician later on. The pediatrician need to keep following that up.
Definitely. Thank you, doctor. So we have a question. Is webbed penis common? My boy has it and his pediatrician said that at 2 he might need surgery.
So it's not very common, but we definitely see it. And we usually delay surgery for later on. So around 3-4 years of age, actually, that's when the surgery is done. If it continues to be webbed, in most of the cases, it does continue to be webbed. But sometimes some release of the tension happens and then surgery is not required.
Okay. Amazing. Another question. When do you advise a newborn and a mom to take a flight? What are the recommended timelines?
Okay,
هلا
so
say wherever you are with
هلا don't
coronavirus.
fly anyway. But just as a, as a general rule,
Yeah.
there are no guidelines on when the baby can travel. Okay, the baby can travel anytime, honestly. The reason why some pediatricians tell parents not to travel early on with the baby is to make sure that the baby is actually healthy. Breastfeeding has been established. If the baby is jaundiced or yellow, that jaundice improved. And that the baby is starting to gain weight, because the last thing you want to do is travel with the baby when the baby is still losing weight, and they lose weight up to the first 10 days after birth. So once everything is going well, there's no reason why you cannot fly with the baby.
Okay,
The pressure
amazing.
does not affect the baby's ears on the flight.
Okay. You mentioned jaundice with Zakari, that is a very important thing to talk about Kamina after birth, so if you can talk a little bit about this, doctor.
So the majority of babies get, jaundiced at birth.
صفيرة.
صفيرة. So we call it physiological jaundice. Okay. هيدي صفيرة ما خاصة بالهيباتيتس بي اللي هو الرئان. Okay. So people always confuse them together لأنه people who get hepatitis or رئان, they become yellow. Okay. So all babies again get some kind of jaundice, and it can be due to different reasons. Okay, the most common reason is just a very mild dehydration. We call it breastfeeding jaundice. So until the mom's milk comes in, the baby gets a little bit dehydrated because they're also losing weight, and they can get a bit jaundiced. Okay, this is normal. It will go away max by 2 weeks of life. Okay. The other kind of jaundice you have at birth is ABO incompatibility. So if the mom's blood group is O and the baby's blood group is something else, other than O, the baby's blood can react to the mom's blood and they can become yellow because they will break their red blood cells. Okay. This is also not dangerous if the level of the bilirubin that causes the yellow color is still under a certain range. Okay. Sometimes we have to put the babies under a blue light to make this yellow color go away. Okay. If the mom also is negative, يعني A negative, O negative, B negative, and the baby is positive, this is also incompatibility, and the baby can develop jaundice as well, this case. Okay. So this is also not, it's pretty common. Okay. The other kind of jaundice that we see that is not physiological, so not normal, is when the direct level of bilirubin is high. Okay, so you have two kinds of bilirubin, one that is direct and one that is indirect. When the indirect level is high, that's normal. Okay, that we can deal with, it's not a problem. When the direct level of bilirubin is the one elevated, that can mean that the baby has like a liver problem or some other diseases. Okay, now there's another kind of jaundice that develops later on at around 2 weeks of life, and that's called breast milk jaundice. Okay, that's different than breastfeeding jaundice, and that's due to a substance in the maternal breast milk that causes the baby to become yellow. We never ever tell the mom to stop breastfeeding.
Exactly.
We never ever tell the mom to supplement with formula just because of that, because in 99.999% of the cases, this is not dangerous at all, and it will go away by 2 months of life.
Yes. Okay. Perfect. So just for you, I know there's a lot of information and technical words there, but just for you to know that usually ما تخافوا من الجانديس. If you suspect something, just get in touch with your pediatrician and follow up with your pediatrician. Okay. We have a question. What is the current recommendation for introducing solids? 4 or 6? Why do some pediatricians push for 4 months?
So I personally start solid food at 6 months. Okay. So first of all, the recommendations are very solid and they're not vague at all when it comes to exclusively breastfed children. Okay. So with exclusive breastfeeding, we do not start solids before 6 months, period. Okay. هاي ما عليها debate. The debate comes if the babies are formula fed or mixed? Okay, do we start at 4? Do we start at 6? Personally, I start at 6 because there are some studies that show that children who start eating before 6 months of life have a higher incidence of intestinal infections. Yani they get more
Okay.
vomiting and diarrhea. Okay,
Mm-hmm.
not a big deal. Okay,
Mm-hmm.
so if you really feel that your baby is ready at 4 months, they're reaching out for food, عم بيتشهوا, they are able like to sit straight, they don't have a head lag, and you're really excited about starting solids, you can, but start very slowly.
Yeah. Okay. لأنه again يعني usually the WHO says 6 month exclusive breastfeeding لأنه still till 6 months the breast milk is the main source of nutrition and is still very
أكيد.
beneficial to the baby. So
Yes.
this is why. Okay. We have a comment, actually, not a question. I couldn't breastfeed my baby and I feel so guilty. Is there any harm caused and what did she miss by not being breastfed? I wanted to read this and I want to let you know, and I don't want you to feel guilty. I know في كتير pressure, you know, moms who exclusively breastfeed are the best and then those who give formula are the worst moms, you know, but it's not like that. عن جد ما بعرف دكتور كمان if you would like to add on me, بس عن جد أنا
So,
what I say to my moms, breastfeeding is plan A. It didn't work, it's you go to plan B. But again, please don't feel guilty, Lano. If you stopped for a reason or you couldn't breastfeed, you had a reason for that. So Anjad,
so
ما
I
if you
just
like
want
to
to
add something.
answer Celine, I think. Uh,
Yes.
I wouldn't, definitely don't feel guilty. Okay.
Mm,
I always tell my patients, and I always say this before any workshop I give, breastfeeding is a personal choice.
mm,
Okay. This is your body. Okay. And you can decide to do whatever you want with it. Yes, we do advocate for breastfeeding لأنه it's great for the baby and it's great for the mother. Okay.
exactly.
But as Cynthia said, not all people can breastfeed and not all moms want to breastfeed. Okay. يعني
Thank you for mentioning that.
مش بس if you tried and you failed, some mom don't want to try. Okay. So to me as a pediatrician, what I do is I try to understand why they don't want to do it. Okay, and I try to solve some of the issues they have with breastfeeding.
Yeah,
And I've had a lot of moms change their minds, and
exactly.
believe me, a lot of it is due to lack of awareness. A lot of it is
Support.
anxiety, support, pain. You know, during breastfeeding, I always come in tell Anna, my moms, that to me as a mom, breastfeeding was one of the hardest experiences of my life. You know,
Mm,
hardest than pregnancy, than delivery, than everything. It was very hard. It's not easy, but it's very rewarding.
exactly.
Don't feel guilty. Again, it's a personal choice. Just make sure that your questions are all addressed and answered before you make that decision.
Yes, I loved the fact that you mentioned that you really need to want to breastfeed لأنه قد ما a breastfeeding specialist, a doctor, anyone can tell you about the benefits of breastfeeding, but if you don't want to, it's not doable لأنه فيها كتير commitments لأنه it's challenging أول فترة فيها commitment فيها تعب فيها a lot, but then at the end like you said it's all worth it. This is why كل moms who breastfeed for 6 months and above, they tell you it was all worth it. It's true, it was not easy, but it got better. You know, it always gets better.
It
So
does get better. It doesn't mean, yani, for all moms that you're gonna love it. You know, I
exactly.
did it and I didn't like it. Okay, but
Yeah.
I did it.
Mm.
So Kamen, we have to respect this. It is a
أكيد.
very good thing for the baby and for the mom, short term and long term.
Long term, yes.
Okay, so even for the baby, long term protection from leukemias, from diabetes, from
Mm.
obesity,
Mm.
you know, the countless.
Mm.
But we cannot judge anyone who decides not to do it. It's a personal
Exactly.
choice.
Exactly, definitely. I have a question regarding the sugar level. You know, after birth, we check the sugar level of the baby and talk about this. I know sometimes moms get, you know, ما بحكي UBM عم بحكي maybe other hospitals, they come in, the nurses, the team, they're like, the sugar level is so low, we need to give a bottle of formula, you know? So I just wanted you to talk a little bit about this. And usually I tell my moms, you know, when the first stage of breast milk, when you have colostrum, please feed every 3 hours, okay? So that we don't go into this, you know? But then we went into this, what do we usually do? And what is the level عادة where we say, okay, we need to supplement?
So this is again one of the things that people should talk to their physicians about before the baby is out. Moms who want to exclusively breastfeed should tell the pediatrician or their gynecologist that I don't want any supplementation. Okay. At UBMC, we don't supplement before asking the parents. But I have to say, Cynthia, that this is a recent thing. Okay. من زمان, people used to supplement without asking parents.
Yeah, definitely.
Thinking that this is the best thing for the baby, and it's not because they want to defy the parents or anything like that.
Yes.
So it's very important to check what the parents' preference is. For parents who want exclusive breastfeeding, even if the sugar level is low, we can always take the baby to the mom and have her put the baby on her breast. And the colostrum, even a tiny drop, will be enough to raise the blood sugar. Okay. So something to keep in mind is that the baby's stomach at birth is the size of an olive. It doesn't require much. And if the mom cannot see any colostrum coming out and she wants to be reassured, then we should help her express some of this colostrum in her breast milk and give it to the baby. I'm against supplementing with formula. I'm against supplementing with sugar water, because this all messes up with the normal, flora of the baby.
So it's always doable with breast milk through hand expression, to having a few drops of breast milk. Exactly. صح?
Yes. We should keep in mind something, is that rarely the baby is born with an abnormality that makes their blood sugar drop significantly. Okay. So no matter what you give, the blood sugar keeps on dropping. It's still low. So these babies sometimes need to be transferred to the neonatal ICU. They need to have, sugar given in the vein until we figure out what's the problem with them. So, as long as parents are well informed, I think we will not have to deal with like rigidity or like ignorance or anything like that.
Okay. Perfect. Should a pregnant woman see a pediatrician? Is it better to see her before giving birth?
So, Hadir, I recommend actually to people to see their pediatricians before birth, لأنه it's a long-term relationship, you see the pediatrician for a very long time. And if you have more than one child, you're going to see them for like 20 years. Okay? Forever. So it's better to meet them ahead of time, because you might not like them. And after the baby is born, you're going to be overwhelmed. You're going to say, you know what, خلاص, I'm just going to stick with this pediatrician. So do your homework like everything else, interview several pediatricians until you find the best fit. I always say that the relationship between the pediatrician and the patient is like any other relationship. There's a lot of chemistry. Sometimes you meet someone you like very much, and sometimes you meet someone that you don't like. You just don't click. And the same goes for us. Some patients we click with them, and some patients we just don't click with them. It's a relationship.
Yes. So yeah, definitely you can see multiple pediatrician and then decide. Pediatrician on call, the one who checks the baby, or we pick the pediatrician for our choice during delivery? Good question.
So it depends where your baby is born. But at AUBMC, the pediatrician who is on call will check the baby. But you can also talk to your pediatrician if he or she are at AUBMC as well. They can come and check socially on the baby. So they might examine the baby, talk to the pediatrician who saw the baby, and come and talk to you. But if your pediatrician is not at AUBMC, they cannot come and check the baby out.
Okay. Doctor, I don't know if you want to add anything related to Kamena exams or tests, anything after birth, if you still want to add something.
So I think we really covered a lot of the stuff, including the circumcision. I just would like to add that the circumcision doesn't need to be a painful procedure. Make sure you ask for a pediatric surgeon or a pediatric, urologist who can provide the right pain medication for your child during the circumcision. It's not general anesthesia, but it needs to. I'm totally against babies crying from pain when we cut a piece of skin off during circumcision.
Definitely, yes. Is it right that newborn should not be taking pacifier due to confusion with mother breast? So if you want to answer, Dr. feel free, but Anna, I will add.
So I would like to say that I'm for the pacifier because it decreases the incidence of sudden infant death syndrome. And sometimes what babies need is really to soothe and to suck on something,
Exactly.
but as long as we don't start it very early. So let's make sure that breastfeeding is established first, that the baby knows what's mom's nipple and what not. And then you can introduce the pacifier. If your baby is hungry, they will not take the pacifier. The pacifier will not mask hunger. Okay, but just make sure that breastfeeding is established before you start giving it.
Exactly. This is what I always tell my moms, you know, make sure the baby is full, baby's not hungry. Then later on, if you want to put the baby back to sleep and you tried a lot of stuff and it's not working, I can't go for the pacifier. It's very soothing for the baby. So yes, but after a feed, not when the baby is hungry.
So just one thing that Christina asked about the safest way to put the baby to sleep, because this is a topic that I feel very strongly about. The babies need to sleep on their back, okay?
Point.
Period. Okay? To prevent sudden infant death syndrome. Not on their tummy, not on their side, on their back. Okay? People around you will tell you put them on their side because إذا دشوا أو إذا استفرغوا ما بيتشردقوا وبيختنقوا. Not true. Okay? The baby is born with reflexes. They have a gag reflex. They have a cough reflex. They can protect their airway even if they vomit on their back. Okay, there are a lot of babies who still die of sudden infant death syndrome from sleeping on their sides. A lot of babies still die of sudden infant death syndrome from co-bedding, so sleeping on the same mattress with mom and dad. These things are a no-no. Okay, overheating, over-bumbling, co-bedding, sleeping on the side, sleeping on the tummy are all risk factors for sudden infant death syndrome.
Having bumper pads, having pillows, toys inside the bed too. No need. No.
Nothing. Yes, exactly. Hard mattress with a fitted sheet. No bumpers, no pillows, no حرمات, no sheets, no peluchette, nothing. The baby sleeps in a sleeping bag. Yeah.
Yes. So I feel wearable blankets. You know, it's like a dress. You call it from
one sleeping bag.
Yes. Yeah. So this is something you can use. Is there a routine meningitis test after delivery? This is another question.
No, there's no routine meningitis test after delivery.
Okay.
Some are no. Just a fitted mattress sheet, no bed covers.
Yes.
In the first 4 months of life.
Yes. And if you go online, by the way, and you write American Academy of Pediatrics Safe Sleep, you can find guidelines, by the way, where it says, and you can see pictures of how it looks like. Okay. There's only one baby in the bed, nothing at all, nothing at all. And this is based on a lot of study, a lot of statistics. So it's not something, hey, a room, you know, just because of they just want to decide this. So via research, okay, this is why we insist on this. What about sleeping on bed next to mom, but with sleep bassinet like the sleepy head?
Yeah, that's fine. The baby can sleep in a bassinet. Actually, this is a recommendation, is for the baby to sleep in a bassinet or in a crib next to mom's bed. So co-rooming, when the baby is sharing the room with the parents, is very protective. Co-bedding is very bad.
Yes. And co-rooming is up to 6 months, right? This is based on the guidelines. Okay.
Yes,
so feed the next to me, a lot of things that you can put next to your bed. So yes, no pillow. Couldn't hear word. Yes, no pillow.
No pillow.
Nothing
I like when they answer each other.
Yes, coming. Okay, so I think we talked about a lot of good stuff. I'm super happy about this and definitely going to save the life for all of you to benefit from, for all of you to re-listen, to share. Please feel free to do that. Lana, Dr. Sharara and I talked about a lot of good stuff, Anjed, and things that you usually ask for. Usually when you're pregnant, it's on your mind, and it's a lot of we addressed a lot of concerns that might be on your mind. Okay, no bumper even after 6 months.
No, after 6 months, Maggie, you can use the bumper because the baby will actually start to turn in bed, and you don't want them to bump their head on the rails. What we recommend now are the individual bumpers that come, like a cover on each rail instead of the big bumper where the head of the baby can go under. Okay, but they are recommended after 6 months.
Okay, thank you so much, Dr. Hanjad, for your time, for accepting to do that, for sharing your knowledge, expertise, Hanjad. I'm super grateful for you and for your time. Thank you so much.